Thank you, Janet. So I do want to say that Dr. Frame was supposed to be here with us today to do the wellness talk. However, she has a critical grant due today, and we decided that we have to protect her time to assure that our operations continue. So you know the drill, questions in the chat. I have like 5 big topics to cover. I have no idea how far we're going to get through, but I want to start with, first of all, show of hand, who was there last week at the Fungi conference, medical mushroom conference. Can I see the show of hands who was there? And I want to spend a couple of minutes to see who had questions about it. I will give a couple of minutes summary of what we have heard. And also, of course, we'll make sure that if you still want to join and look what was recorded, that we'll put in a link to everything. You can have a full access to it. I'm going to put shameless plug to myself that I think my presentation was interesting, using mushrooms for prevention and treatment of Alzheimer's disease. But there were lots of other very interesting presentations. So we had Paul Stamets. Those of you who know, he's kind of the man in the medical mushroom world. He's kind of known as being the face of it. Of course, the fantastic fungi on Netflix, the kind of multi-million-dollar enterprise on Netflix, is Paul's creation, Paul's idea, and he's all over that. All the series have him in there. So Paul was giving a pretty interesting idea about a couple of specific mushrooms and also clarifying some really interesting points. We had Dr. Weil and Dr. Heyman giving us a fascinating talk about some molecular aspects of some of the specific components of mushrooms, saying that, guess what? Something that can be very beneficial, like a mushroom concentrate, can actually be harmful too. So they can be pro-inflammatory for some individuals with certain genetic makeups. This is a brand new information. So if you're taking mushrooms and you're sort of wondering, oh, I can just take more. Well, turns out the mushrooms, actually anti-inflammatory mushrooms or immune modulating mushrooms, can actually be harmful for some people. So they gave a whole talk on how this happens, why, what are the molecular and genetic underpinning of that. So that's a very fascinating talk. We had like dozens of emails after that talk saying that this is like, I've never heard this. This is so interesting. We had one of the co-founders of the entire psychedelic research, who started Johns Hopkins Psychedelic Research Program, present on power of psychedelic mushrooms for a variety of let's call them psychological disturbances and trauma. That was for me, was, I think, probably the most interesting talk, because I didn't grow up in that era. Well, I did grow up in that era, just not here. So I missed that whole 60s and 70s Freedom Act, hippie time, whatever you guys call it. So for me to kind of being there and hearing him talk about all this was fascinating, and sort of the history of how research started, how it stopped, how it restarted. So definitely, if you're interested, check it out. We had a really good talk on cancer and use of medical mushrooms for cancer with our own Dr. Oser. I'm actually probably going to ask her to do that talk for us here in a much more sort of, compacted form. I think my talk is a little too small for you guys. It's too narrow, like a couple of mushrooms just for Alzheimer's. It's very big in my field because, there's nothing for Alzheimer's. So that's an interesting topic. But I think the topic of mushrooms for cancer in general would be much more interesting. So that's kind of just the highlights. I think we also there was several other things that were very interesting, but I just want to give you a couple of minutes of highlights. Okay, so that's one. I'm going to check the questions now because I know there's a lot of questions, and I also want to talk. Cecile brought up a very interesting article about the fact that it appears there's a data that Moderna vaccine is safer and more efficacious for older adults, and I'm just going to dispel that myth right now. I'm going to show you the article and say that's completely irrelevant to what's going on today, just because how the study was done. But I want to suggest for the future that when you find something like this, please do what Cecile did, which is definitely send it to us because it's really important for us to look at it. Otherwise, we basically, you don't know how to analyze this data. You can't really read this very well and say, oh, okay, that's an important study. The study is important for historic purposes and some other things, but let me just bring that up and point out, right? Still, before I do that, Pfizer and Moderna, your basic choices right now. Can I see, do we have a volunteer who would be willing to say that they've got the booster and they're willing to say a couple of words about their experience with that? Okay, Jennifer.
So I got it. I don't know which one I got at CVS, and I felt okay for the first few hours, and then I started getting the super bad chills in the evening, and then I had a terrible night. But about midway, 2 or 3 in the morning, things started looking up, and I felt pretty good the next day. So for a minute, I thought I had COVID again. I mean, I was just whacked, but then I felt fine. And my husband, who also got it, had a sore arm, and that was it. I had the lymph node under the shot arm got very swollen, and that took the longest to go down, but everything else cleared.
Great. Did you have any logistical problems getting it? Like, were there
No, but I was in Philly, and I've heard there are logistical problems at least in Northwest DC. I had no problem getting an appointment. I couldn't get a that day appointment, but I could get the next day.
Okay. Anybody else? Thanks so much. Anybody else want to share anything? Problems in the VA? Kathy just wrote. Okay. All right. Okay. All right. So let me show you the study. And by the way, if you have anything else, just raise your hand. I'll keep an eye on the chat. So this is what Cecile sent. It's kind of all over the news right now. So basically, it was published back in August. And you can take a look at this link. What I really want to show you is an actual study. So indeed, it's actually published in the JAMA network. So you can't get any better than this. This is a very serious article, very good article, very well done. But there's one little caveat. Here's what I want you to show you here. This is basically destroys the entire purpose of the study discussing it for today. So they conducted the study for the vaccine that's completely irrelevant. This vaccine doesn't exist anymore. Nobody's getting it. So comparing something that what happened in the past is basically irrelevant because the current boosters are different. They're less potent. They don't contain some of the original strains. So we have no idea. So Cecile, I don't know if you can use any of this study for any decision-making whatsoever. I highly discourage you from doing that. And I think because of that, I'm going to sort of, because of that, I don't think I'm going to change my recommendation. I'm basically going to say, get whatever you feel like getting. I don't think that the study is going to help you one way or another, just because the study is looking at the historic vaccine, not at what boosters are currently available. However, it is possible that if you're really, really worried about side effects, do get Moderna. And the reason is that theoretically, it's slightly less potent. So if you're more concerned about side effects than an efficacy, get Moderna. If you kind of like, oh, I want to get the most potent, get a Pfizer. Rest of you should really not care. I think the difference is minuscule and not important. Jennifer.
I was talking about the RSV vaccine, not the booster. I misunderstood your question.
No. Hold off the RSV vaccine.
Sorry. I'm sorry. I confused the issue. I did not get the booster.
Let's go back to the table. So who here has gotten new COVID booster? And who's willing to say about it? Because that's all right. I saw Catherine lifting hand initially. Kathy Goldberg, do you want to unmute and say a couple of words?
Okay. Yes, I had the Pfizer and absolutely no reaction to it.
Good. Did you have
a couple days ago?
Were you in line? Were you like waiting? Did you have to reschedule? Like, were there any logistical?
No logistical problems at all. But of course, I'm in New Jersey, so I'm not in
okay.
the
All right.
area.
Thank you. We value the New Jersey input, but I think everybody else want to hear something a bit more local. Okay.
I think so.
Yeah, I got the Pfizer booster, but I had Moderna. All the other vaccines were Moderna. and I had no reactions. It was fine, and the logistics were also all fine. However, I did get COVID. So we I just tested positive this morning. We were on a trip in Europe, and so it happened.
Okay. Do you have any symptoms?
I have symptoms, but it's like a bad cold, and you know, achiness, but we're just dealing, both my husband and I have it, and we're just dealing with it with Tylenol. Okay. And rest and liquids and
well, since you know, if you want, message me. We'll find time today or tomorrow to talk if you have to. If you're doing okay then. So remember one thing real quick. We know that the vaccine does not prevent getting COVID.
Right.
We know you're not getting to do that. The vaccine doesn't do that at all. It decreases risk somewhat, but very minimally. It just decreases severity. That's all we know. And you got it here, right? You got it in DMV?
No, we got it. I think we got it in Paris, actually. It was, yeah.
Anybody who got the vaccine in DMV, because I've heard from several of my patients horror stories. Like,
no, sorry, we got the vaccine here and everything was fine, but we got COVID, I think, in Paris. Yeah.
Did you have any problems getting vaccine in DMV?
No problems at all.
And when did you get it?
I can't remember whether it was CVS or a Safeway, but we got it at in August.
In August, late August.
Late August.
Oh, no. Okay, all right. So it's a lot.
So that's not the.
No, that's not. You got the old vaccine.
Okay.
So you did not actually get the boost, the updated booster.
Oh, okay. I thought it was. But
no. The booster came out in the early September, and it was not available right away. So now it is, but they're like, I have heard from several patients like really difficult stories of having a hard time getting the new ones, and the old ones already removed from the circulation. My understanding. All right. Anybody else want to add something to it?
I actually have a question.
Okay. I don't know who's talking, but go for it.
It's Benita. I have a question.
Okay.
Should we, especially if we've had massive adverse reactions to prior boosters, maybe consider mixing and matching this go around?
Yeah, so, you know, I don't know how to answer that. It's a good question. I've said that in the past, mix and match. I think the data for that with the new booster is not available yet. So unfortunately, I'm going to just kind of cautiously say, if you feel like doing it, I don't see any harm in that. So go for it. But I don't know whether or not there's enough evidence to say from the past that it's worth it. My take on this is basically goes like this. Most people shouldn't care. But if for whatever reason you feel somehow one way or another, by all means, go for it. That's what I'm saying. Okay, I know there's a lot of questions. So what I would like to do first, and let's, Catherine, Commander, go ahead and ask your question, and then I'll address it.
Well, I just wanted to add to what you were asking about people's reactions to things, and so I haven't had the most recent vaccine, but I did want to say that I had quite severe reactions to the first several. And once I started doing the protocol that you've shared several times, including, I think, pretty recently in the last couple of weeks, the protocol virtually eliminated the reactions that I was having. So I found it super helpful, and maybe it would be helpful to others.
Yeah, if you're my patient, you most likely gotten this statement already, because we've observed this with a lot of our patients. There are some patients in whom I can't mandate this, but I almost like basically say you have to do this, because if I know you've had a significant inflammatory response to the shot, then I say that. Now the problem, okay, let me shift real quick to RSV, because now it's also relevant. Jennifer, the problem is that I don't, this is such a new vaccine that I have taken a little bit of a step back and said, I don't know, like I'm always a little more cautious than everybody else, especially since one little thing that's actually not so little. We had a bad RSV last year. Who said that this year we're going to have bad RSV? No one has any idea. RSV fluctuates dramatically. There's some year where there's none of it, and then there's some year there's a lot. We have no clue what's going to happen this season. So just like doing what CDC says, everybody over 60, just get it, just get it, just get it. I am very, very careful. There's a lot of things we need to get. We need to get a flu. We need to get a COVID, now RSV. Are you going to? So now imagine if you have a little bit of a pro-inflammatory response already in place, and you're going to get all these things. Guess what? 2 weeks ago, we had a head of the autoimmune program at UCLA giving us grand rounds. And you know what he said? He said, I don't allow my patients with lupus to get the shots. I have to talk to them. It's very careful because everybody flares after the shots. So that's a head of the program who basically says, I am very careful. Like, I hear that the vaccine saves life and stuff, sure. But I see the reactions in my patients and I can't ignore it. When I hear something like this from a head of a program who sees thousands of patients with autoimmune condition, it's my duty to do the same, is to say, look, hold your horses. Let's be very careful and not like blindly follow CDC guidelines and just say, oh, sure. Oh, you have cancer, you have lupus, we're good. No, I think the wisdom here goes like this. And I like that CDC said that. CDC said, if you carefully read how they put it, they said, talk to your doctor. They actually put that in writing. They said, you have to discuss this with your provider and make a mutual decision whether it's worth getting. And so saying, oh, I'm going to go and get it just like this is, you need to, if you're very healthy, you're concerned, you have travel coming up, you're not worried about this, sure. I don't think you have to talk to someone, just go and get it. But if you have what Catherine described, which is, I know her personally pretty well, the story, there is a lot of potential reaction to certain things. So you have to take it with a lot more, you have to think about this differently. So thanks, Cecile, for saying no reaction to RSV. Thank you. You had, Cecile, did you already have the new Pfizer? Or did you get you got that back in August like Catherine? I think you're muted.
You're asking about the RSV?
No, I'm asking about the Pfizer. I'm asking about the, oh, you got the RSV Pfizer, sorry.
Yeah, there are two RSVs. One's Pfizer and
Right,
one's GSK.
Yes.
The only one I could find was Pfizer at Giant. So
Right.
I thought you had said get it rather than worrying about which one.
No, I was talking about the COVID. So let me go back, sidetrack for a second. I'm worried about COVID more than I worried about RSV. And not necessarily because there's no risk with RSV. No, the thing with RSV will only affect the lungs, and RSV basically in the worst case scenario, it's easier to manage. The problem with and it doesn't leave long lasting effects. The problem with COVID is not the COVID itself, like you just heard Catherine. I mean, everybody's getting. The problem is that we still see a lot of long COVID, a lot. And I'm talking about 10 to 20% of everybody who's getting COVID now, 3 months later, are half disabled. And that's what my main concern is still. Long COVID, you guys, is not going anywhere. And the vaccines are not helping it. Well, actually, I don't know that for a fact. I don't know if the new booster is going to cut on cases. We think it probably will, but what that percent real cut be, unfortunately, nobody knows yet. We'll have to wait and see. The thinking is that the old COVID boosters and shots were cutting long COVID in half. You know what that means? It means that the risk was going down from, let's say, 10 to 20% down to 5 to 10%. In my mind, 10% risk of long COVID is not acceptable. It's 1 out of 10 of my patients who potentially going to be disabled for a long time. And trust me, Ashley and I do this day to day and we see consequences, and it's scary like hell because I have elite athletes who are completely on disability, life destroyed fully. So, you know, I hope that we get it. The trend seems to be lightening up, like that it's a little bit better. But also remember, it's all number game. So if right now we see a massive uptick in cases, so if we're all going to get sick, so we have 39 people right now here. You know what that means? let's approximate to a lowest possible chance of 5%. That means that 5 out of 100, or about 2 people out of all of us, are going to get long-term years of side effects post-COVID. And, that's why I'm more aggressive with the COVID boosters than I am with RSV, because the problem with the issue with RSV, let's say you're 65, you don't have lung problems, you may have hypertension, maybe you have diabetes, mild or something. Okay, you'll get RSV, you'll get bronchitis for a couple of weeks, maybe you'll end up with a course of antibiotics. Okay, you'll get over that. Okay, and we know what to do. What happens with the COVID? Yeah, I mean, sure, that it's probably going to be relatively mild, just what Catherine has, but we just don't know. We can't predict who's going to end up with that long COVID scenario. We think that our tools that we're giving everybody, all these supportive tools, are actually working, but do we really know? Well, no, we don't. It's like we're doing this, but we don't actually know whether or not indeed we're changing the course of illness. We're just hoping that we are. So that's just basically my statement on RSV. With all that, if you're planning on getting it, don't let my chit chat persuade you against it. By all means, I still think you should get a prep. I think everybody should get prep for everything, even for the flu vaccine. At some point, if anybody wants, we can share that prep again. I know we did it many times, but still. All right, I'm going to scan the chat real quick because I still have a whole topic, actually 2 topics, but I don't think I'm going to be able to do both. We'll just do one. Janet posted that if you guys want to get the link to the Fungi conference, please email her. Oh, sorry. Thanks, Cecile. Remind me, you guys unmute. If you can't hear me, just unmute, because I don't always carefully monitor the chat. Okay, yeah, I answered Kathy. We'll get you links. At some point, I may talk about Alzheimer's, and I may include conversation about mushrooms there.
Misha, is the prep information, is that on the CIM website? Where can people find it?
No, we presented it here many times. It must be in one of the prior slides.
Okay.
But it sounds like we're going to have to do it again.
Yeah, it does.
All right. It's a combination of something called DHIST and then 3 homeopathics. So what I'll do is, unfortunately, I don't have a break here today. So I'll have to figure out how to get the list of things to you. But you can always just email Janet and I can actually order it for you with a wholesale discount. So that's another thing we can always do. Benita, okay. So yeah, so you, unfortunately, we don't have a lot of people getting boosters, so I'm not sure how to answer your question. I would say for sure try to get a prep. Supposedly insurance issue has been resolved. I have had about maybe a dozen of patients getting the booster in different ways. I have not heard from anybody that there's been some kind of billing involved. My understanding that insurances are not like refusing this, is, it would definitely be up in the media immediately, I'm sure. No, the recommendation is the reverse. Get the COVID booster first. I never said get RSV first. In fact, I said the following: COVID first, flu second, RSV third. That's what I said all along. And the reason for that goes like this. It's a statistics. That's all there is, nothing else. The COVID is here. Neither RSV or flu are here. Nobody knows when they will be here. Historically, it goes like this. The flu comes in around early November. So best time to get a flu shot, that's my opinion, not necessarily fully in agreement with CDC. I think CDC just get it now, which I disagree wholeheartedly with, and I'll say in a second why. I think you should get a flu late October. If the flu season hasn't even started, you haven't heard of any cases, you haven't seen any of your friends getting it, you can even push it into the November. Why? Because the flu shot lasts for anywhere from 2 to 3 months tops, and then it's gone. It's zero protection. I mean, it's like 5%, it's zero. And the problem is the flu period, the flu season actually peaks sometime in January, February. And in March and April, you still have a tail end, which is pretty strong. If you get it in September, if you get it in early October, you're completely unprotected come April, zero protection. And the data has been around for many years. What I am saying now is extremely important to remember. So never get a flu shot early. Totally doesn't make any sense. It doesn't give you any additional benefit because the flu is not going to arrive until late October. Now, RSV game is a little more complicated because nobody actually knows when it will arrive. It varies a little bit year to year. The last season actually started a lot earlier, I think it was early October. But I still will stick to the same statement. I would say get your COVID vaccine now. Get your flu at least 2 weeks, preferably 3 weeks later. And then if you want to get RSV, get your RSV 3 weeks after that. Now, the good news about RSV, they think that the vaccine is going to last for a while. I don't know whether it's going to be an annual thing. We're going to have to see, but it's definitely going to last way longer than the flu shot because technology is different. It's also an mRNA vaccine. They tend to linger a lot, so their longevity is much better than the old vaccine. One last thing about flu shot, if you have a strong egg reaction, don't worry. It's the first year that the flu shots no longer contain any real problems with egg allergies, just so you remember. Okay, let's finish screening the questions. Yeah, there is just one strength, but the two different vaccines. And so the problem is that they're both slightly different. So that whole conversation, Pfizer versus Moderna COVID booster has some relevance. Hence, you brought up this great question and you brought up the study. And I do commend you and I really appreciate you doing that because that helps me to stay current and keep an eye on this because I don't always find everything. So thank you. Okay, can I get my RSV shot with the COVID vaccine? Okay, so you heard me. Yes, the CDC said you can get all three together. If you're my patient and you do that, it's not like I'm not going to talk to you after, but I would be like, I told you not, well, I wouldn't say, but I would start getting aggravated because to me, there's no real reason for that. There's no reason to challenge your immune system that much. Now, if I'm a physician in a certain area and I really have to just find the patient because they'll never come back to my office, and I may push them to get everything at once. But you're here on your own accord. I didn't drag you into this meeting. I presume that you're all very health engaged. Don't do that to yourself. There is zero reason to follow this CDC stupidity, in my opinion, and say you must get no problems getting all shots together. They can't really effectively assess this. In order to carefully do this, you're going to have to take exactly same cohort of patients with exactly same problems, randomize them, and then no one will ever conduct study like this. We'll never have a full answer to this question. But the reality is be careful. It's a common sense. Vaccines stimulate the immune system. You have no clue what that cocktail does between itself and why. What are you losing by spreading it out? Okay, half an hour of your time, that's about it, right? And, so it's a common sense wisdom that if you're not in a rush, do it that way. I understand if all three diseases would be here. Let's say we wake up tomorrow and the government puts the news that flu is here, RSV is here, and COVID just tripled in numbers. Okay, well, that changes the story. But right now, and I don't expect that to happen. So in my mind, you have to think about this. You have to time the vaccines to the best of the coverage, right? So, all right. What about echinacea? Gold said before. So if you were to attend the Fungi conference, one of the things you would have listened to is the MAX trial, which is basically they took the Chinese formula that had mushrooms, it had some other stuff, and they gave it to the people who were getting vaccine. Guess what? It's dramatically boosted efficacy of the vaccine. So if you're interested, if you're a nerd like me and want to know about the latest and the craziest study, you can listen to this in recording. Bottom line, I do believe in that. The problem, Cecile, is that we don't exactly know which herbs to use because the data on that has never been studied. There has been some studies done a long time ago with both echinacea and golden seal, potentially showing benefit of flu shot. I can't really comment on that more. I will tell you that Tai Chi seems to dramatically boost flu vaccine efficacy. There's been a very high-end quality study on this, and this MAX study, but that's a pretty specific cocktail. It's a cocktail, it's a Chinese medicine cocktail. If you're interested and you want to hear it, We can actually discuss that at some point. The problem is it's a proprietary blend. It's not so easy to obtain, unfortunately. But I already had few patients after the mushroom conference ask me, should I be getting this cocktail? And my answer is, yeah, sure. If you can figure out how to obtain it, I don't see any reason not to. It was done pretty simple. It's not like many weeks of something, just a certain amount of doses. It's easy to take, not a lot of side effects. So, yeah. Okay. Is there any data yet on long COVID patients or patients with a history of long COVID getting the flu vaccine or new booster? Well, that's a great question. Yeah, that's $1 million question, probably the most important question of the day in my mind. I don't know, Katie, I don't think we have any data. It's interesting that in the past, the idea was patients with long COVID should be getting more boosters. That was the idea, right? Because you really don't want them to get another COVID, since the fear was if they get another COVID, they get really, really worse. Unfortunately, the data is only available for the old boosters. In fact, it's not even for the boosters. I think it's for the original series. That's all we have. So I don't think that we're going to answer this very soon, unfortunately. My gut feeling, the answer would be yes. And only because I would say that as much as I would be afraid of giving any additional vaccines to anybody without the immune or any kind of inflammatory condition, but I would be worried about COVID more. That's my only answer. I am not sure about the flu. The flu vaccines are relatively benign, but for people who are young, getting a flu, even if they have long COVID, we don't know what it's going to do either. So I think that flu, I don't have a good answer for. It's a great question. Okay, I think this year's senior version of the flu is against the same exact. Yes, that is correct. So if you're over 65, you should be getting either, it should call a high dose flu vaccine. I think there's separate different names for it. I'm not going to give you those because I don't exactly know what actual name is going to be. I don't think we actually have the flu vaccine at GW yet. I haven't seen any memos. It's probably coming in the next week or two, I'm guessing. Usually they start distributing it in the first week of October. Okay, if one had that strong flu vax last year, doesn't want, yeah. So the flu vaccine, you just heard my explanation, Elizabeth. Flu vaccine lasts for like definitely less than 6 months. The real protection lasts from between 2 to 4 months at tops. So whatever you had last year is irrelevant today. Plus the virus is constantly mutating. So the strains of a flu from last year is going to be completely not covered by the last year's vaccine for this year. All right. So if one had strong, would it be better just to get COVID vaccine? Yeah, so this is all really good questions that really have to be individualized. If you never had a flu reaction and you're relatively young, let's say you're somewhere between 40 to 65, you don't have any medical problems. Like, honestly, I don't get the flu vaccine for one particular funny reason. Even with the PrEP, I'm out of for a day or two with the after vaccine. I just get fever, and even with the PrEP, I mean, good immune system, I guess. When I get a flu, I'm out of the work for a day or two. Like it doesn't, to me, when every time I had a flu or the vaccine, I get the exact same symptoms. And after a while, it's like, the only reason I would be getting flu vaccines to protect my patients. But we're masking everywhere. I'm masking everywhere still. And so now I don't even see a real strongest of the reasons. And most of what I do is this way anyway. So I'm just my logic. Now, if you, on the other hand, had a bad flu, definitely get the flu shot. Why not? What are you risking there? Okay. All right. Sharon, I'm getting COVID and flu shot next week. Can you share the PrEP? Okay, so Sharon, again, if you can separate, don't get them together. Week is not enough, and getting flu shot next week is too early. So you should get it probably at least 3 weeks from now. So third week of October would be my suggestion. And I can send you a PrEP, no problem. Just remind me if I forget. PrEP starts 24 hours before the vaccine. If you want to get a new COVID shot, how long should I wait? Okay. All right. I had one in booster. So the CDC says 6 months. And I'm kind of in agreement with that minimum of 6 months. I don't like less than 6 months. The CDC kind of says, well, you can probably be at least as 4 months. It is a little individualized. My suggestion generally goes more towards a little longer. So for a lot of people, I wait for 10 months, but I don't see any problem with April because it's, it's 6 months roughly. So, okay. My understanding is that the new COVID vaccine is an mRNA, not. No, that's not my understanding. The new COVID vaccines are the similar mRNA vaccines as before. They are all boosters. They're designed for the particularly Omicron. They no longer contain an original strain. They no longer cover the original strains back from 2 years ago. So I think they are called boosters by default. Okay, I had a booster in May. Should I get? So yeah, so Linda, for you, if it was May, you may want to wait for a month or two. I think that gets a little bit, I don't know your personal situation well, so I think I would want to, again, this is the situation where this kind of that borderline where you may say, maybe worth waiting for another couple of months. But you can also think of it this way. If you're going to travel, if you think you're going to get into some high risk situation, well, get it now, don't wait. I think 6 months or 5 months, it's too small of a difference for me to say something about it. Here in New Jersey, some hospitals have reinstated. Correct. We're starting to see this. I would not be, mark my word, I would not be surprised that in a couple of weeks, DC will reinstate healthcare facilities mandate because the spike is happening and it's pretty quick. So it would make a lot of sense, actually, if I were to be in the government, I would have made that already, that the inside health facilities mask mandate should be reinstated, but I'm not. So I'm going to see what's going to happen. All right, last point, and then we have 20 minutes for mind body, which is, I think, good. And I didn't cover my other topic. I'll have to leave it for some other time. Assuming you still advise waiting 6 months, for the COVID booster after action. Yes, that is correct too. But the same, Jennifer, I actually often tell some of my patients to wait even longer, like 10 months roughly. So. Okay, the things I didn't actually cover today was fascinating study coming of Thailand showing that a specific turmeric extract is actually better than omeprazole for control of acid reflux. We will try to do this study here in US. We just talked to the head of the study today. I will try to get him on my YouTube channel in the next couple of weeks, but I find it fascinating. It's a really cool study. It's a very well made. It was run with their government-made turmeric capsules. It's a full extract turmeric. It's not an extract, so stay tuned for more. The idea that volatile oils naturally occurring in turmeric can be effective for regular acid reflux. I've never thought of that. So I find things like this fascinating. All right. Well, maybe what we should do, since it was all me, I will kind of pause for a minute or two and kind of recenter myself. If you need to run to the bathroom or grab a glass of water. In fact, I will do just that. I feel like I need a 30-second break so that I get a glass of water, run to the bathroom. So no more than 2 minutes, okay? So don't go anywhere. Stay here. Okay, well, let's regroup. Someone put music on, it was so sweet. And actually, that's a great idea. Why don't we do that? Because why not? I'm gonna put my recent best find, which is healing power of 40 hertz music. And we're gonna do a couple of basic breathing techniques to it. I think I've done this already once, but I think it would be really good to do it again. And I see someone saying if you can hear the music that's playing on my end. Can you hear the music? No?
No.
That's okay. I know why.
I think there's like a background noise filter on Zoom, right?
Yeah, that's what I'm about to do.
Ah, okay.
I just need to find it. But now, still no.
In other business, if you did not get my email from the chat, if you are interested in the recording from last week's Medicinal Fungi Conference, please open the email that I will be sending you after this event. It has my email in there at the bottom.
That's unfortunate.
And you can send it to me.
Not working out. I'm gonna turn music. I'm just gonna. All right. Well, let's all find comfortable sitting. You may want to. You can lay down for this. It's totally fine. We're going to do a heart-centered meditation practice. If you're laying down, I would suggest that you tune into your pulse. Some of you may be able to just feel your heartbeat. If you don't, you can put your hand here on the neck, or you can also put it on your wrist, or you can just imagine heartbeat. I don't think it really matters. I think what you're trying to do is you're trying to sync your breath with your heartbeat rate. So what we'll do is we'll
Can you speak louder, please?
speak louder. Sure. And I'll also going to make Mike a little more sensitive. Is that better?
Yes, it is.
Great. So begin by closing your eyes, starting to pay attention to your breath. With each inhale, pay attention to sensation of your chest is rising. Feel how your ribs are moving. Become aware of where your physical heart locates on the left side of your chest. Once you're comfortable with settling in, slowing the breath, becoming more aware of your physical heart. Connect to the heartbeat. Again, you can imagine it. You may be able, if you want, you can just feel your pulse. And let's begin by inhaling for 4 heartbeats and exhaling for 4 heartbeats, which is going to be a little fast first, but we will begin to slow this down. Your inhale and exhale is the same length. Let's shift to the 5 count of 5. So inhale on count of 5 heartbeats and exhale on 5. If it feels comfortable, go ahead and try to shift to 6. So inhale 6 heartbeats, exhale 6. For most of us, this is a good place. But if you still feel like you would like to go even slower, you can try 7 or even 8. Otherwise, stay with 6 and begin slowly to tune deeper and deeper into the left side of your chest. It's not just the physical location, it's also the location of our emotions, location of our intuitive sense of the world, location from which we often judge our environment by. This kind of a quick intuitive realization of comfort, safety, or not. Remember, the heart is not only the physical center of our cardiovascular system, the pump. It's also a very important sensory organ. It's directly linked to the brain through the two-way street that supplies information both ways. And our thought processes are heavily influenced by the way our emotional world is, and the heart is at the center of processing of all that. So let's begin to add a strong positive emotion. And you can, if you want to, you can imagine someone you love. Maybe it's your significant other. Maybe it's your favorite pet, even when they're barking in another room. Or maybe it's just your favorite place in the nature. Whatever it is that you need to do to invoke this state of love, caring, compassion. And with each breath, center it right in the heart. Inhale, bringing that deep positive state into your heart. And when you exhale, radiate it back into the earth, into the surroundings, to other people, to the universe. Everything is in balance, just like we have inhale and exhale, the same way. Whatever gifts we get, we have to make sure we have reciprocity of giving them back. Check in with your face. Make sure that you're not holding tension. Forehead, lower jaw, maybe your eye muscles. You know your areas where you tend to hold the stress. So just check in with those areas and inhale. And then when you exhale, see if you can release the tension. See if you can sink deeper into the breath. Still staying present to the heart. If you're still doing the counts, you can release that. Just stay in the presence of the heart domain and in a state of that positive awareness. Whatever that emotion that is in your heart, just cherish this for a couple more minutes. And if your heart calls you to keep in close sense or close connection to the heartbeat, if you're suddenly realizing you actually can feel the pulse without physically using your hands, if that starts happening, by all means, just stay present to that. Let's take 3 more breaths here together. Slowly come back, open your eyes. And before we close, let's do something that's commonly done in Qigong. We're going to rub our hands for about 30 seconds like this. And then if you have a glasses, take the glasses off. And then we're going to just kind of put our hands right over our face and then very gently go up and down, massaging the forehead, releasing the tension, kind of slowly letting the hands to feel the muscles of the face and let them relax. And then before we close, put both of your hands right over your belly button, like this, like one on top of the other. We'll exhale together. Inhale slowly and deeply. And then exhale and come back. And say goodbye to each other until next week. And I don't know if Janet is still here to tell us what do we have next week.
I am still here. We have Lucy Gable with us, who is another GW faculty member of our integrative medicine programs, and hopefully she'll be able to do the mind-body practice.
Thank you, everybody. Tons of great questions today. Again, if you want the questions to be prioritized, email ahead of time. Email Janet if you want the link for the Fungi conference. Email me if you need a prep. We'll see you all next week. Have a wonderful weekend, everybody. Bye.
Thank you.